So I think we'll get started. Hopefully you can hear me okay. So I am Teresa Agnew. I am the CEO of Biogaia, and I wanted to present our company to you and then open it up for some questions. So first off, we are a probiotics company focusing on some core health areas of gut health, immune health, and oral health. We were founded in 1990. We have over 500 granted patents and over 1.5 billion SEK in terms of our revenue. We have three regions where we operate, the Americas, Europe, Middle East, Africa, and Asia Pacific. So we're one of the only truly global probiotics companies because we're in 113 markets. And we are listed on the stock exchange. Our vision is to become the most trusted probiotic brand in the world. And these words are very important to us, trusted. So, trusted by healthcare professionals, doctors, pharmacists, nurses, trusted by parents, trusted by consumers. And part of our differentiation to deliver on this vision is our science. We're very focused on clinical science. As you see in our mission, is to have clinically proven probiotics that benefit people in terms of health and well-being. So clinically proven, we spend almost 10% of our net sales on R&D. So this is important for us in terms of developing new products, developing more clinical studies so that we can have claims and advantages, differentiation on our probiotics. Our strategy, we have three strategic pillars. Our first is what we call grow the core. The core meaning our core health areas, which I mentioned. Gut health, which includes colic in infants, immune health, and oral health. In this area, we spend the majority of our resources, people, time, and money, on new products, line extensions, commercial excellence, marketing initiatives, building our brand around the world. Our second strategy is what we call expansion through direct markets. So think of this as markets where we build as a subsidiary of the company. The majority of our sales, about 60%, is through distribution partners. Those partners are typically pharmaceutical companies or nutrition companies around the world, such as one of our larger partners is Abbott, which I'm sure you're very familiar with Abbott, a large pharmaceutical and med tech company, as well as Evopharma, which is a pharmaceutical company based out of Switzerland. And with them, we work with over 15 markets in Central Eastern Europe as well as Switzerland. But expansion through direct markets, our direct markets, we have 12 direct markets, which I'll talk a little bit further about. And we're growing ahead of the market and ahead of our distribution partners through our direct markets. And then our third strategy is what we call breakthrough innovation. Think of this as market creation opportunities for probiotics. So where probiotics are not regularly used today. Typically, people use probiotics for their gut, for gut health and gut balance. But there are other areas that we are exploring right now. We just launched a new division called Biogaia New Sciences that's focusing on skin health. So we have now a probiotic ointment. So it's an ointment or a cream where we have our patented bacteria strain in the ointment, and we have also a patented technology that keeps the bacteria alive in the ointment. It's very difficult to do this. There are many products around the world that say they have probiotics, but they actually don't, because probiotics means live bacteria. And what this is for children who have eczema or atopic prone skin, very dry, sensitive skin, redness. And we've launched this product, it's called Aldermis, in the US, Canada, Sweden, Finland, and the UK. And we're getting very good feedback from many parents in terms of they've tried so many other things that didn't work, and then our product works for the child, sometimes within days, sometimes it takes 2 weeks, depending on the severity of the condition. But this is a new area for us around skin health, which I'll talk a little bit further about. Two other areas in breakthrough innovation that we are exploring and doing clinical studies and looking at new products is metabolic health. So think of this as people with metabolic syndrome, which is a large part of people around the world. And what we are doing is looking at things like triglyceride reduction and a number of other areas within metabolic syndrome. Additionally, another area in breakthrough innovation is brain health. So think about this as helping people who may need positive mood changes, stress. We just launched a press release and about our clinical study where we found the first ever bacteria that actually produces serotonin. So serotonin helps people to have better mood and release stress. So these are really exciting areas that we're exploring for the future. And then our foundations. This is very important because without these, we wouldn't grow. Our people and our culture is absolutely number one. Our company values are focused around innovation, collaboration, and passion. Investing for profitable growth. Again, these words are very important. Profitable. We look at what investments can we make in our direct markets to drive growth. So, for instance, last year we invested heavily in our U.S. market and grew that business 30% organic growth in 2025 in a probiotics market that typically grows in the low single digits. Digital as an enabler. This we think about in terms of how we go to market with our digital strategy from an omni-channel approach, making sure our products are available in all the different channels where consumers want to buy them, as well as digitizing our internal business. How can we be more productive, more efficient, less manual? Driven by science. This is a foundation with our company the last 35 years. I'll talk about this more. We have over 290 clinical studies in 25,000 patients. This is very unique in the probiotics market to have this much science and differentiation. And then finally, sustainable solutions. This is an important area for us in terms of helping us to have a healthy business, a healthy planet, healthy products. Again, I'll talk about that a little more. But this is our overall company strategy for Biogaia. So I talked about our distribution networks. We have 12 direct markets, and as you can see here on the map, those are US, Canada, UK, Finland, Sweden, France, Netherlands, now Germany and Austria, which we just launched in January, Japan, Australia, and New Zealand. And then the the purple dots are all of our partner network around the world. As I said, pharmaceutical companies, nutrition companies that we work with. And in terms of our business model, in yellow, you see where we have Biogaia employees around the world. And then in kind of the light bluish color is our universities and researchers that we partner with around the world. This is very special for Biogaia because we have this vast network that we use in terms of preclinical studies, clinical studies. We bring those scientists and researchers together from academia on a regular basis, and this helps to contribute to the differentiation in science that I talked about. In purple, this is where we manufacture our products. For the most part, that is in Europe. We also work with some CMOs, some contract manufacturing organizations that compress our tablets, create our capsules. We also do a majority of our production in-house in Eslöv in the south of Sweden. And then finally, again, our partners around the world. So a little bit on our product portfolio and also our new products. This gives you an idea of all the probiotics we have available for the entire family. And again, we focus gut health, immune health, and oral health. And we have pediatrics as well as adults. All of these products may not be available in every country, but this is what we have as a portfolio. And what we work on is in some of our countries, we may just have pediatric products, but we're growing into the adult segment because that's a high growth area and it's a very large area of the market. So just to give you a sense, our Protectus product line is really for everyday gut health as well as colic specifically for infants. So colic is when you have excessive crying over 3 hours for an infant in a day. So with this, we have multiple formats. We have our drops products, which is our best selling. We also have tablets. We have capsules in Protectus. We have powders as well, so a number of different formats. Also, we have Gastrus. So I'll talk a little bit about a new product that we launched, which is called Gastrus Pure Action. This is our adult gut health product, specifically focused around irritable bowel syndrome, which is when you have excessive constipation or diarrhea. And there can be, depending on the market, anywhere between 20 and 40% of people that have irritable bowel syndrome. So it's actually very common depending on the country. And we have clinical studies in irritable bowel syndrome as well as in H. pylori infections. Then, in addition, we have our immune focused products. We have Pharax, which is a drops product, which helps with upper respiratory tract infections, cold and flu symptoms. And then, in addition, as I said, we have oral health. This is a really interesting area where we started focusing on this much more in 2023, and we've been growing this substantially where we're focusing. This is for your mouth. So this is a probiotic. It's a lozenge. I highly encourage you to try it if you haven't. You put it in your mouth. It melts in your mouth over a couple minutes. It builds a biofilm in your mouth of the good bacteria to outweigh the bad bacteria. You can actually see and feel the difference because people who have inflamed gums, they see an effect within a week, typically, where you can then have pink, healthy gums. Also, about a third of the population globally suffers from what we call bleeding gums. So when they brush their teeth and they spit, they have a little blood in their spit. They think it's because they're brushing their teeth too hard, but it's actually early signs of gingivitis, inflammation of your gums. So when you take our product, it can eliminate the bleeding gums. So this is a really interesting product to prevent and treat gingivitis, periodontitis, and a number of other areas such as wound healing after you may have dental surgery or implants, things like that. So very interesting growth area for us. Then specifically, this is a new product we launched in October of 2024 in Finland, which is now available in about 11 markets. This has really been a success for us. We have exceeded our business plan in terms of our growth in sales. And actually, in Q4 of 2025, this product alone was our third highest growth contributor in terms of million SEK to the company. So this is doing really well. Again, another product I encourage you to try if you haven't. It's what's called FODMAP friendly. So gastroenterologists will recommend a low FODMAP diet for patients that have digestive issues. So meaning, low in fermentable oligosaccharides, disaccharides, and so forth. So this product works very well for irritable bowel syndrome, again, as well, H. pylori, but very focused on irritable bowel syndrome. And very positive reactions from healthcare professionals as well as consumers around the world. So we have high hopes for this product as we continue to roll this out this year. In addition, last year in Q3, we launched Prodentis Fresh Breath. So I told you about Prodentis working on gingivitis, periodontitis. Now, what this is you take our probiotic patented strain combination, and then you add zinc. And zinc helps with fresh breath. So this is a really good product for whole mouth health as well as fresh breath. We launched this in the US. It's growing every month. And then we're continuing to launch this. It's now in the UK, Germany, and soon more markets this year. And in addition, I talked about skin health. This gives you an idea of our skincare product line. So I talked about our probiotic ointment, which is the one in blue, which is specifically focused for children with dry, sensitive skin, eczema prone, atopic prone skin. But in addition, what we're just launching this year, is two complementary products because we went out with the probiotic ointment to parents and they said, okay, this is great. It works for the eczema, but I also need to wash, my infants, my children who have these skin conditions. So I want to wash. That's very clean and microbiome friendly, as well as an everyday lotion. So we've also launched these. These do not have probiotics. They have prebiotics in them. So these are very high-end premium skincare lotion and wash that you can use for children with very sensitive eczema and atopic prone skin. It feels really great. I actually use it myself. So really nice line of products in the skin health area. So I mentioned before, driven by science. We have over 35 years of proven science with our clinical studies. And we have to date, it looks like that's right in the middle. Sorry. 290 clinical trials, almost 140 are in children, so 25,000 patients. So really strong arsenal of efficacy, safety, proven clinical science behind our products. And I talked about sustainability. If you look at our achievements, we were actually rated in 2025 by Time Magazine as one of the top 500 global companies for driving growth and doing it through sustainability. We also achieve very high ratings from an ESG industry standard. And a number of our other areas, EcoVadis, which is an external body, puts us in the top 15% in our industry. All of our packaging and paper materials is FSC certified, so Forest Stewardship Council certified, and we have an MSCI AA rating. So as you can see, sustainability is very important to us in terms of our strategy and how we deliver in terms of the environment. And our strategy itself, I mentioned earlier, healthy products, healthy business, healthy planet. As I mentioned, we have transparent research, clinically proven effects of our products, a positive impact on health. Product quality and safety is very important to us. Over 5 different quality tests for every product, testing all of our raw materials. We are HACCP certified as well in terms of a food product. We focus on sustainable packaging and raw materials, as well as responsible third parties and employee engagement. So that is our overarching sustainability strategy as a company. So that is Biogaia. Again, we are a leading probiotics company globally in over 100 markets, focusing on gut health, immune health, and oral health, and some of the newer areas such as skin health, getting into some breakthrough innovation areas in the future as well. So I open it up for any questions.
Yes, thank you very much.
Thank you.
Yes, very interesting product launches, which seems to be doing just fine. But can you speak something about your more established products, the colic product, for instance? Is that still a growing product for you? Is that a growing market?
Yes.
Or what's the outlook?
Yes, so for our drops product for infants, especially around colic, it is a growing product for us. One of the things we're doing, we have a strategy we call also beyond colic. So not just focused on colic for infants, but also what are the other areas. So that's also helping us to grow the drops business. So things like constipation. So children, so like an infant, when you go from breastfeeding to then bottle feeding, they will go through constipation. So that is a time in a child's life when they would need a probiotic to help with the constipation. Another time is when they go from liquid food to solid food. It's also a time of constipation. So what we do is we market to particular events that happen along as the child grows. So not just focusing on colic, which grows our drops business, but also these other indication areas to continue to drive penetration and growth. So that is continuing to grow for us. But the adult segment that I mentioned earlier is growing ahead. And that's because it's a larger part of the market and even has what we call kind of a stickier consumer. So the consumer will stay with the product longer because if you find something that works for your mouth and your gums, you're going to then stick with it. Same thing if you find something that works for your gut, your irritable bowel syndrome, then you're going to stay with it a little longer. And what we also focus on is when the child grows, so as an infant to then a toddler and then into 3, 4, 5, 6 years old, we focus on what we call customer lifecycle value. So how we drive them to then the chewable product to continue the therapy.
Okay. And how much of your business is kind of infant orientated?
So what we talk about is pediatrics. So pediatrics includes drops as well as chewable tablets for children, and that's about 75% of our
75%.
business.
Okay. Okay. A very active area for you is your strategy on going direct in several markets. And you are telling us here that this has worked very well for you.
Mhm.
You had tremendous growth in direct markets. Can you provide us with some background? How do you think when you decide to go direct in a market? What kind of actions can you take that you could not take before? And what's your playbook for go direct, and why has it worked well for you?
Yes, good question. So with direct markets, we have a strategy around what are the best markets for us to take direct. First off, it's the larger probiotics markets. Secondly, it's either markets where we have a large business that we feel we can continue to grow significantly, or where it's a large probiotics market and we have a small business today where we maybe have a partner that's not as focused on our product, and we then think we can accelerate it and grow it. And I'll give you an example of that. Australia. So we had a great partner, but it was an infant nutrition company focused on their baby formula. And so they really weren't focused on our probiotic drops to the extent we wanted. We took that business direct, and within a year, we became number one in the market where we had never been previously. So not just growing our brand, but also growing the category for retailers as well. So that's just an example of Australia being the 12th largest probiotics market in the world, large probiotics market, and then we've come in and been able to become number one in drops. In addition, now because we have the market direct, we make the decisions on the new products to launch. So previously in the pharmacy channel, we didn't have our chewable tablets, Protectus chewable tablets for children. We didn't have our Prodentis. We didn't have our Gastrus product. So now we have rolled that out for broader distribution, and then we're growing, substantially in those areas as well. So that it gives us the freedom to then be able to make those decisions of when we want to launch the new products, how much effort we want to put behind it. The other advantage to taking a market direct is then we have responsibility for the marketing and selling activities. So again, we make those decisions on the investments. When we have a partner, they're making those decisions, but we're influencing them in terms of making sure that they're focused on our products amongst their portfolio.
Okay, and how far can you go? You have a 40%, I believe, direct sales.
Yes, right now we have 40%. About 2 years ago, it was about 30% of our sales. So we've grown it dramatically. We anticipate in the next year to 2 years, we'll get that to 50%. We don't anticipate at this point to take any more, major markets direct at this point, but we're always evaluating it. We always have a plan. More to come on that.
And will that automatically mean you will earn more money, or rather have higher margins when you sell
It
direct?
depends on the model for that market. So, for instance, where sales are more online, such as Amazon, we have a lower margin because we pay fees to Amazon. So, if we're going into a direct market where there's Amazon, then I would say there's not as much margin improvement. In markets where it's more pharmacy, bricks and mortar pharmacy based, where we do have a higher margin, then we will see that. So typically what happens when we sell to a distribution partner, they then capture margin and sell to the pharmacies. So if we're direct, we capture that margin. But again, if it's Amazon business, heavily an Amazon business, then we don't see as much of a step up in our margin.
I
And
see.
also, the additional thing is we then take over all the logistics and shipping of the product. So that then goes into cost of goods.
Mm.
So with our partners, they do all of that work.
Okay, so it's margin dilutive rather?
No, it's not margin dilutive. So it's either equal to higher.
Equal to higher.
Yeah.
Okay, any questions from the audience?
in terms of gross margin.
And
Gross margin.
I will repeat the questions from now on, but we have a question there.
Yes. That is actually up to our board. So the board, in terms of what their recommendation is, so what they will do is they will be looking at capital allocation, over the course of the next year. So we still have a very healthy dividend. So we have always said that we would deliver on dividend, but we communicated about 2 years ago that we would pay the extra dividend even more, and so we're still paying an additional 72%. So still very high on the dividend. So I can't answer that directly. There will be more conversations, of course, in the future in terms of what the board would recommend.
And the question was concerning buyback of shares, was it?
Yeah,
Yes.
dividend
Okay.
versus
Yeah.
buyback.
Okay. Because you have a pretty hefty net cash position. I think some 800 million Swedish crowns or something like that. And you have that for some time actually. How does that make you feel as a CEO? Don't you want to use it?
Yeah. Yes, a number of years ago, we did a capital raise. This was before my time, looking at some potential acquisitions. And we didn't see acquisitions that really met our strategy with the scientific expertise and differentiation that I was talking about. So that's one of the reasons we've been giving an extra dividend over the past couple of years. So we continue to look at different transactions. We scan the market in terms of potentially new strains. So we're looking at things currently in some of our breakthrough innovation areas. What could we acquire? What could we license for new products into the future? But we'll continue to give, I think, a healthy dividend as well.
I
But
see.
can you say something about how do you prioritize between acquisition, investments, and dividend?
Yeah, I would say we always want to give a healthy dividend back to our shareholders. So that's one thing. That's an important priority. But then in terms of investments, as I said earlier, our direct markets are growing ahead of our partner markets. So we are investing in these markets to drive more growth. So that's very important to us. I would say the organic growth is more important in terms of if I look at an acquisition versus the organic growth at this point. But we're all, like I said, we're always looking at different, strains, new technologies that we could potentially acquire for the future.
Okay.
Scan the market. Any more questions? Yes.
Yes.
I'll have to repeat the first question. What kind of growth targets do you have a little more long term,
Yeah.
I believe? And the other question, have you had any setbacks when going direct in some markets?
Yes. So, in terms of growth, our ambition is low double-digit growth for each year. So we don't give particular guidance, but that is our ambition. And then in terms of direct markets, we've been very successful going direct. So I wouldn't say we've had any major issues. I think one of the areas in France that's going really well for us. So we're getting more distribution of our products. So for instance, we had a partner previously that called on a certain number of pharmacies, and we've more than doubled that now because we have a contract sales force that goes out and calls on pharmacies. So that helps us to drive distribution even broader. And we also have partnerships with companies where they go in and talk to pediatricians about our brand. So, I think we've done very well in France. We set some records in September and Q4 in terms of our sales, and I think that will go very well for this year as well. So we haven't seen any major, I would say, setbacks when we take a market direct. There's always challenges as you go in terms of, okay, you have to pick the right third-party logistics provider. We hire local consultants for regulatory, legal. So we keep a very lean team in the direct market. And we tend to outsource, so we can do that, lower fixed assets. But no, I wouldn't say there have been any major issues. I think also we have a lot of learning because we now have 12 direct markets. So we have a lot of learning as we take on a market and scale it up. So that helps us because we have lessons learned in terms of how we do it.
Okay, I think our time is actually up. So we will have to thank you for a very interesting presentation.
Great. Thank you
Thank
very
you.
much.